All right, members, as we get started on the last bill, I will make a motion to voluntarily defer Senate Bill 278 by Representative Jackson Andrews. She's just not here today, so we're going to hear that bill next week. I have a motion to voluntarily defer Senate Bill 278. Any objections? Hearing none, that bill is deferred. Next bill up, and the final bill of the day, I think, is HB 707 by Representative Jordan. Taylor, can you read it in?
Thank you, Mr. Chairman and members. We have House Bill 707 by Representative Jordan relative to cannabis, to provide for definitions, to provide relative to the cultivation, processing, and manufacturing of cannabis and cannabis products, to provide for licensing, to provide for the authority of the Department of Agriculture and Forestry, to provide for criminal history checks and suitability requirements, to provide for license fees, to provide for transportation restrictions, to provide for civil penalties, to provide for personal cultivation permits and fees, to provide relative to the retail sale of cannabis and cannabis products, to provide for retailer permits and fees, to provide for age restrictions regarding the purchase of cannabis and cannabis products, to provide for other restrictions with respect to cannabis, to provide relative to the suspension or revocation of permits, and to provide for related matters.
So just for the record, members, as we get going with this, we don't have a quorum now, so we'll get everything started, but we'll need a quorum before we make any moves. Representative Jordan, on your bill.
Thank you. And look, I do have a couple of amendments. Well, I don't know if you can even offer the amendments right now until you get a quorum. But anyway, so here's what we've got. This is a very simple bill. What it does is it is for the adult use of cannabis. It sets up the retail side with dispensaries and how we would do that. As most of you know, this is not a fiscal year, so even once we pass this sets the framework. We still would have to come back next year from a taxing perspective and set up a tax structure so that we could tax it. But the main thing in this bill, and for you, those of you who know, I've brought this in the past, this has a home grow component to it. And let me just tell you why. I had a friend of mine who had battled some issues with addictions in the past, and had bought some cannabis last summer, took 2 puffs, dropped dead. Was laced with fentanyl. We having these issues with fentanyl, the lacing of marijuana and cannabis with fentanyl now, and it's an issue. So part of what I have here is a home grow component. I figure, hey, look, my thought is if you grow your own, unless you've laced it with fentanyl yourself, you should not have any issues. We can't bury our heads in the sand and think that people aren't going to get access to cannabis. They've gotten access to it since the beginning of time, and they're going to continue to do that. The question is, how do we make it safe? How do we regulate it? How do we tax it? How do we make money off of it, frankly? There is, and Kevin Caldwell will speak in a minute, but I can tell you from a taxing perspective, and the state looking at a budget shortfall, there is a need to create more revenue streams. This would easily be a revenue stream, and I think over the next 10 years would provide over $1 billion in tax revenue, not in sales, but in actual tax revenue. So an average of over $100 million a year that would be going to our general fund if we decided to do this. So with that, I will entertain any questions, and I do have Mr. Caldwell just to speak on some of the numbers.
Good afternoon. My name is Kevin Caldwell. I'm the Southeast Legislative Manager for the Marijuana Policy Project. If we were to bring this illicit marketplace above ground, we had the Vicente Law Firm's economic forecaster do a model for Louisiana. They are the industry leaders in this. Some of the important points that they brought up was that it is estimated of adult cannabis consumers currently in Louisiana is 430,000. The adult use market size by 2033 would be $900 million. The total regulated market between 2024 and 2033 would be $5.8 billion. The study put adult use into becoming an actuality in 2027. And so adult use tax revenue between 2027 and 2033 is $1.17 billion. These numbers are based off of Representative Freiberg's adult use tax bill last year, which did the regular state and local tax base plus a 15% excise tax. The total Louisiana adult use cannabis industry fiscal impact in that 2027 to 2033, which is a 2.8 multiplier, would be $13.4 billion. And by a multiplier, I'm talking about all the other industries that would benefit from an adult use market being implemented in Louisiana. If we have any questions, I'm here.
Yes, we do have a question for Representative Selders.
At the appropriate time, I'm moving favorable.
Okay, now it's not the appropriate time. We do have plenty of cards. Okay, I'll go through the green cards first. What Representative Butler for questions?
Do you have a model that you followed? Was there another state or... Because I know there's other states, like I have a daughter that lives in Colorado. Yep. In Colorado, it's legal and they have vending machines and that kind of thing. She's not a big fan of it, but, she didn't totally against it, but not a big fan of it. But I'm wondering if you followed another state.
So what we did, ma'am, was we looked at all of the 24 states that have now legalized adult use, 54% of the United States population, and we utilized numerous ways from that. So we did not necessarily, just look at a state. We looked at all 24 states and how they were regulating.
How are they regulating based? So I have a company, and in my business, we drug test. And if you have any drugs in your system, because I have CDL licensed drivers, there's a lot of issues that I have to follow. I'm regulated by insurance, just, workman's comp, liability, all those things. So how is that?
So let me just tell you briefly on that. So nothing in most of the states that I know of, and I've talked to the Small Business Association and NFIB. Mm-hmm. So I've talked to them, and what I would tell you is this has no impact on employee-employee relationships, workers' comp, any of that stuff. So if you got a TWIC card and you're working in the plant and all those things, and you test negative or you test positive, and so it doesn't have any impact on that. In fact, now if you have a medical card for medicinal use, that might Yeah. But even with that for issues of workers' comp and some of the other areas, it doesn't make a difference.
Have we seen in any of the states the crime, go up or down, or how is that regulated? I mean, a lot of people ask me that.
Actually, we have numerous reports that I can provide to you, Representative Butler, that shows that crime does not affect, and in fact, the Journal of American Medicine released today that actually legalization does not affect youth usage as well, which I know is a big concern.
Is the potency regulated?
That's a state-by-state decision, ma'am.
Okay. I think that's all right now.
Thank you, Representative Butler. Listen, we have a motion. Well, I'll make a motion on the floor to adopt the amendments. Taylor, can you read them in?
Thank you, Mr. Chairman and members. The amendments set before the committee can be identified by the number in the upper right-hand corner is 3571. These amendments are available online and have been distributed to members. There are a total of 17 amendments in this set. Amendments 1 through 10, 13, 16, and 17 transfer the administration and regulation of the cannabis program from the Louisiana, the Department of Agriculture and Fisheries to the Louisiana Department of Health. Amendment 11 removes the cap on the number of licenses that LDH may issue cultivators, processors, and manufacturers of cannabis products. Amendment 14 modifies the requirement to obtain a license to provide that a stakeholder shall not be disqualified for being a stakeholder if he was convicted or pled guilty to a felony if the offense was marijuana related. Amendment 15 removes the civil penalties for violation. This concludes the amendment set.
All right, members, are there any questions on the amendment? Okay, I propose we adopt them. Any objections? Okay, amendments are adopted. We have several people, green cards, that the president would like to speak. Kevin Caldwell is at the table, already spoken. Devin Davis with Voters Organized to Educate. Bill Richard with Blue Basin Cannabis. Blaine Jennings, president would like to speak with Virgin Hemp. Tommy Landry, Veterans Actions Council. So whoever are here, you wave. All right, look like everybody's waving with the green cards. We do have other green cards in support that would not like to speak. Bruce Raleigh, Peyton Rose Mitchell, Chico Yancey. I understand. Give me a second. Yasminique Hookfin, Keandra Henry, Dwayne Dugas. All of them are present in support if they'd like to speak. And I called your name to speak. You want to speak?
I'll wait.
You wave? Okay, he waves. All right, so we have 2 red cards. One of them present in opposition but do not wish to speak is Trinity Wicker with Gene Mills, Louisiana Family Forum. And then present and would like to speak is Dr. Will Hall.
Thank you, sir.
And Mr. Chairman, I have 2 handouts that I'd like you to inspect. I'm Dr. Will Hall, and I'm the Director for the Office of Public Policy with the Louisiana Baptist Convention, a fellowship of about 1,550 congregations in Louisiana. About 450,000 baptized adults are represented by us. I've given you a couple of handouts to illustrate the problems with legalizing marijuana. The first is a representation of marijuana abuse among high school students. And if you look, this data was taken before we brought hemp into the state and before we legalized medical marijuana. And our high school students were number 14 in the nation in the abuse of marijuana. I didn't give you this handout, but they're number 1 in the nation in alcohol abuse, number 1 in the injection of illegal drugs. That's the kind of problem we're facing with our high school students. Marijuana, particularly THC, does not discriminate between children's brains and adult brains, but we have a growing population of damaged adults. But I'd like to spend most of my time just speaking with you about the negative impact on children of legalizing marijuana. If you look at the second handout, I tried to focus on the states that have been legalized the longest: Oregon, Colorado, and California. And Oregon Health and Science University, you can see that they have studied the data for 20 years, and they've seen a 245% increase in teen cannabis abuse. In Colorado, the headlines, and these are not Fox News headlines, but the Springs Gazette, heed the data: pot is poisoning kids. AAP study, pediatric edible cannabis exposures and acute toxicity, shows that children are suffering. If you go to California, when they did studies in 2017, 2018, 2019, after they had legalized recreational marijuana, they saw that a surge in adolescent use of marijuana. So you can have laws that regulate who can legally buy it, but that does not stop youth from getting access to it. We've seen time and again, each state, when you give more access to marijuana to adults, you give more access to children. And if you go to the second page, you can see that the National Institutes of Health have done a study, and they see that cannabis use is associated with suicidality in young adults. The New York Times, psychosis, addiction, chronic vomiting. As we become more prominent, teens are getting more sick. And so it goes on and on and on. A recent study that just came out: smoking cannabis just once can change a teenager's brain. Another headline: smoking cannabis is associated with risk of heart attack and stroke. And we saw that the National Heart and Lung Blood Institute found that this predominantly smoking pot was associated with 25% increase in heart attacks, 45% increased likelihood of stroke. One last thing, if you allow me. I know you had a veteran at the table. I'm a veteran. And I have veterans' health is a burden to me. Yale did a study of 2,276 veterans with PTSD and who were medicating themselves with pot. And they found this. There were worse outcomes of PTSD symptoms, severity, violent behavior, and the use of alcohol and drugs. We don't need to bring this scourge into our state. We just don't. This is not about allowing adults' use of pot. This is creating addicts of your children because they need a market to follow the ones that they would target now. Thank you.
Okay, we have no more cards and no questions. Representative Jordan, if you'd like to close on your bill.
Thank you, Mr. Chair and members. Look, we're not bringing this into the state. It's already here. So let's not ignore what we already have here. The real issue is, do we want to regulate it? Do we want to make it safer for our kids? Do we want to make sure that we don't have this laced with fentanyl in some gray or illegal market? I think if we bring it above ground, we regulate it, we're able to test it, we're able to do all these other things to make sure that it's safe, it's going to make it better for our kids. I would ask, I know we have a motion from Representative Selders. I'm going to be brief because I know you guys have been here long. I would ask that you allow this to go to the floor, let us talk about this further, and we can certainly deal with that. I could give you other studies that contradict what he says in states where it's been legalized and tell you that use by kids ages 13 to 18 have reduced. And from 18 to 24, you have seen a slight increase. But that's with any college-age kid. I mean, those are the times when they're going to college and they're going to do that. So I would just, again, ask for your favorable passage.
Okay, members, Representative Selders has made a motion to report HB 707 favorable with amendments. Are there any objections? Hearing none, HB 707 is reported favorable.
Thank you.
Motion to adjourn by Representative Stephen Jackson.